Stanford itself has a history of surgeon innovators, interventionalist innovators, who have fundamentally changed how we practice medicine by developing new devices and new ways of doing procedures. I started out as an engineer, and I really love just designing and building stuff and the advanced technology that is the world of R&D engineering, especially in the academic community. But as I was going through my PhD, I realized that there's this really kind of stark disconnect between me as an engineer who's doing all this work to help people and the actual people that I'm trying to do that for. I never had seen the patients for whom I was designing, and that bothered me a lot. I felt like in order to be a good engineer, I had to understand the problems that these patients were facing, and so I decided that I would go to medical school midway through my PhD in engineering. I spent my first year of professional development in the Biodesign Program, and what the Biodesign Program is, it's a full-time, 10.5-month program that brings together engineers, physicians, and people with a business background and teaches them how to do needs-based innovation. They teach you the ins and outs of taking an idea and making sure that idea will have success later on as a product being used on lots and lots of patients. So the Biodesign program works in such a way where you have teams of about 4 fellows. This year it's a little bit different because of COVID. There's 2 teams of 5. But basically you are evaluating hundreds of ideas, hundreds of problems, I'd say, hundreds of needs in the clinical environment, and then figuring out which one of those needs is going to be able to survive the entire process of commercialization. So our team had a couple of ideas come out of it, or a couple of needs come out of it, and one of them was a respiratory care need that me and a fellow teammate took forward this year. For my second year, I was a clinical innovation fellow at Intuitive Surgical. And Intuitive Surgical is the company that makes the Da Vinci surgical robot. It's when you hear robotic surgery, that's the robot that we're working with. And being a clinical innovation fellow at Intuitive has been a really eye-opening experience. It's been a great experience. The people at Intuitive are some of the most brightest, brilliant, just incredible people that you'll meet. And I got really lucky that I got matched up with a mentor. His name is Jamie Wong, and he's just given me this bird's eye view of the company and how all the different business units work together to achieve the common goal of the company. So it's really rounded out my experience of biodesign. You know, biodesign, you get real close to what it looks like to have a startup, and startups are very scrappy, and I don't use that in a negative term. They bootstrap, and they're really efficient and lean with what they do. And you have a company like Intuitive who has a great margin and are able to really do things properly, just exactly the way you'd want to do it, because they're not bootstrapping. So it's really shown me these 2 aspects of innovation and how industry works to achieve the same kind of outcome. We all have limited time to change the world around us, and you have to have a strategy. What I know is that I want my career to be taking care of patients and doing device innovation on their behalf.